The decade of the spine. Lumbar spinal stenosis. The help you need has arrived. As a brain and spine surgeon with many years of experience treating patients in New York and Westchester County area and beyond, Dr. Cornell has seen his fair share of older patients suffering from lumbar spinal stenosis. He sees them at all stages of the condition, from the first hint of the problem all the way to very advanced cases. It's troubling to see how these patients suffer needlessly before seeking treatment. For this reason, he'd like to declare that the next 10 years be devoted to awareness of the spine, its growth and nurturing, its health and well-being, and its importance in one's overall physical stamina. Let's call it the decade of the spine. Caring for our spine is something that should be taught at an early age. As children, we need to learn how to use our bodies properly, how to lift, how to carry, walk and run, sit, and even sleep. What is learned from these lessons needs to be practiced throughout life. We should not only utilize proper body mechanics and back supports, but also develop robots and other mechanical devices to do our heavy lifting, no matter how menial the task. When at play, whether running, skiing, jumping for a basketball, reaching for a tennis ball, or swinging a golf club, we should know how to do it in a way that limits damage to our spine. At its core, that's what the decade of the spine is all about: education, awareness, and prevention. Lumbar spinal stenosis. The statistics don't lie. Lumbar spinal stenosis, or a narrowing of the spinal canal that compresses the nerves passing through, affects 10% of the population of folks in their 50s. What Dr. Cornell sees as a neurosurgeon every day are individuals who are eager to lead active, full lives, but find they are unable to do so because their deteriorating spines are limiting them profoundly. Medical science, the key to a long, healthy, and happy life. We are living longer. Medical science has found ways to reduce heart, lung, and cerebrovascular disease among the many conditions that are now being either cured or more successfully managed. Coronary artery stenting has substantially reduced the number of heart attacks, and carotid artery stenting has reduced the number of strokes experienced by an aging population. We still have a long way to go, and you can help. The degenerating spine often leads to severe pain in the back or neck, often both. Pressure on nerves from herniated discs, arthritic bone spurs, and thickening and weakening ligaments can lead to pain in the legs or arms, weakness or even paralysis, loss of feeling, and when severe, bladder and bowel dysfunction. There are a host of therapies that can be helpful: chiropractic, physical therapy, massage acupuncture, exercise programs, as well as medications ranging from steroids and non-steroidal anti-inflammatories or non-narcotic pain medications and narcotics. The power of the right treatment and the right time. For the right individuals, surgery can be helpful. In fact, it can be very helpful. Surgery can allow people to resume an active, even normal life. It cannot, however, give someone a new spine. In truth, the spine, inexorably, continues to degenerate over time. We cannot replace all the discs and all the joints in the spine either. That will never be possible. Perhaps with stem cell therapy, we may be able to reduce the rate of disc degeneration. And with genetic engineering, we may be able to stave off early degenerative spine disease in those individuals who have inherited progressive spine disorders. But for the majority of patients, preventing damage to the spine is by far the best option. Dr. Cornell, the care you need with the passion you deserve. To learn more about the decade of the spine, contact our office at 914-948-0444 or visit our website, topspinesurgeonnyc.com.